Hello students, today the topic we are going to cover is hypnotism and meditation. This lesson will help you in learning about two different states of altered consciousness known as hypnotism and meditation. To know more about the nature of altered consciousness or types of altered consciousness, please follow the lesson with the title Characteristics of Consciousness, Levels of Consciousness and Altered States of Consciousness. There are different types of altered states of consciousness like sleep, dreams, drug-induced altered state of consciousness, meditation and hypnotism. But in this lesson, we will purely focus on meditation and hypnosis. You will also get to know the myths and facts about hypnosis, various theoretical perspectives of hypnosis, and you will understand the significance, or I would say the importance of meditation and the broad classifications of meditation. How can you reach an altered state of consciousness without drugs? Well, the answer is meditation and hypnosis. These are the two types of techniques that can promote a relaxed state of mind in us. Hypnotism and meditation are two different altered states of consciousness. First, let's discuss or focus on hypnosis, and later we will discuss about meditation. Now, I am sure most of you might be curious and excited to know more about hypnotism and the facts behind it. By now, lots of people, you students might be questioning, and lots of questions might have raised in your mind about this topic, like is hypnotism is true, as we see a lot in movies? What actually happens to a person when he is in a hypnotic state? Well, before that, first let's try to understand the concept of hypnotism with a definition. I'll provide you two different kinds of definitions. The first is hypnotism or hypnosis is a social interaction in which one person, that is the hypnotist, suggests to another, that is a person or a participant who receives the process, that certain perceptions, feelings, thoughts or behaviors will spontaneously occur, which means, if this definition is clear, we require two people for hypnotism to happen, that is a hypnotist and a subject or a participant who involved or who is ready to get hypnotized. Or else it can also be defined as a highly relaxed, suggestible state of mind in which a person is likely to feel that his actions and thoughts are happening to him rather than being produced voluntarily. If you observe the first definition as well as the second definition, one word is reflecting. What is that? Suggestible. Yes, if you keenly understand the concept of suggestibility, it means you understood the concept of hypnotism. Yes, so suggestible or suggestibility is a state of mind where a person readily accept and act on the suggestions of others. So, this word I keep on using till the end of a concept of hypnotism. So, try to understand what is suggestibility, where a person is ready to take instructions by other person, he is ready to act as said by other person. So, this is known as suggestibility. Now, the person being hypnotized sit quietly and focus on some target, that can be a particular sound or a particular object that is in view. The hypnotist speaks to the person quietly and monotonously, encouraging her or him to just relax. The hypnotist also offers various suggestions about what will happen, including many things that are just inevitably as a person relaxes. Your eyelids are dropping downward or your limbs are getting heavy. Gradually, the hypnotist leads the person into a state of deep relaxation and extreme suggestibility, where a person is ready to act upon the instructions or the suggestions given by the hypnotist, which usually happens when the person is in deep relaxed state. Earlier, hypnosis has been in a traditional approach of psychology. For example, Sigmund Freud, who is a well-known figure in the field of psychology, tried to include the process of hypnotism to treat people with hysteria. However, this process of hypnotism did not meet the expectations of Freud in his therapeutic applications. Hence, he started developing his own therapeutic techniques. Now, those who study hypnosis have agreed that it is a power that not in the hypnotist, like who is doing, they don't have any magic, they're just giving instructions, but it all relies on the subject's openness to suggestion. As I said again, I am repeating the word suggestibility, suggestion again and again. What does it mean? It is the readiness or openness of a participant. The subject or the patient is important. It's nothing like a magic in the hands of a hypnotist. So, hypnotists have no magical mind, control power. They merely engage people's ability to focus on certain images or behaviors. But how open to suggestion we are depends solely on us, not anyone else. To answer this, what I'll do, I'll just share some facts and falsehood about hypnosis. The first question is, can anyone experience hypnosis? To some extent, we all are open to suggestions, yes, but not all of us have same amount of experience. For example, one person can easily get influenced by the hypnotic suggestions, but some people might be reluctant because they should be ready, they should be open up to the suggestions given by the hypnotist. Okay, so what does he mean is, people with hypnotic suggestibility are highly hypnotizable. Some people are more vulnerable, some people are more suggestible, they are highly able to get hypnotized. Now, many researchers refers to a term called hypnotic suggestibility, which means it is a hypnotic ability, the ability of focus attention totally on a task, to become imaginatively absorbed in it, to entertain fanciful possibilities. So, whatever they say, whatever the instructions given by the hypnotist, they should be ready. So, the suggestible ability, suggestibility should be there in a person. The higher the suggestibility in a person, the greater the chances for a person to get hypnotized and go to a higher possibilities. Now, the second question is, can hypnosis be therapeutic? Now, post-hypnotic suggestions have helped alleviated headaches, asthmas and even stress-related skin disorders. What does it mean? It means what all the symptoms I just said, headache, asthma, some of the skin irritations are most of the time created due to psychosomatic symptoms, that is because due to stress. And these things were successfully treated with the combination of a medication as well as hypnotic suggestions. So, studies reveal that clients who received therapy supplemented with hypnotism showed greater results than other therapy patients. So, people who just received treatment versus people who received treatment also supplemented with hypnosis, the result is greater. Now, the third point is, can hypnosis alleviate pain? Yes, to some extent hypnosis can relieve pain. So, for that I would share a study with you. In a study, when unhypnotized people put their arm in an ice bath, they feel intense pain within 25 seconds. When hypnotized people do the same, after being given suggestions to feel no pain, they indeed reported feeling little pain. So, what is this? What's happening over here? Is it like people are lying? No, there is some dynamics behind working that I would explain when I cover the topic theories of hypnotism. Okay, so when the suggestion is given by the hypnotist not to feel pain, or you are not feeling pain, the amount or the intensity of pain felt by the patients is less, which means in people who are highly susceptible or highly suggestible, for them, while during surgeries or any treatments, this hypnotism can work as anesthesia. So nearly 10% of us can become so deeply hypnotized that even undergo a major surgery without anesthesia. Half of us again at least some pain relief from hypnosis, but again it all depends on your suggestibility. If you are ready, it can work, but if you are not open up, your suggestibility levels are less, this might not work for you. So which means these are all the three factors. Like, can anyone experience suggestibility? Can it be therapeutic to relieve from, and can it be elevate pain? Yes, this can happen to some extent, but again it all depends on what? Yes, well, right said, it all depends on suggestibility. Now, but what is the mechanism behind it? What's happening? Is people are lying, or is it like it's not true, or is it fake, or is it some understanding between the hypnotist and the patient? To know this, I would like to share some of the theories or theoretical perspectives which explains the mechanism of hypnosis. For that, the first theory I would like to share with you is dissociation theory. What this theory says is, several researchers even proposes dissociation theories that view hypnosis as an altered state involving a division of consciousness. Division word is nothing but disassociation. So there is a division within your consciousness. So there are two levels of consciousness of functioning over here when a person get hypnotized. So one of the researcher, Hilgard, proposed that hypnosis creates division of awareness in which the person simultaneously experience two streams of consciousness. Now consciousness is a stream of activity, right, mental activity, but over here what's happening, it's getting split into two, and they are simultaneously two streams of consciousness are working that are cut from each other, and again these two streams are not related with each other, they got disassociated. One stream respond to the hypnotist suggestion. So whatever hypnotist is saying, one stream is actively involved in that, it got busy in that, while the second stream is a part of consciousness that monitors behavior which remains in the background, which means it observes, it knows what's other stream of activity is doing, but it just keeps silent and remains in the background, but is aware of everything that goes on. And Hilgard named this second part of consciousness which is at the background as hidden observer. I mean, it observes everything hiding behind, but it doesn't involve. To get more clarity, what I'll do, I'll share a small example with you. Okay, when suggestion is given to a person that your arm will start feel lighter and will begin to raise, then the person who is under the influence of hypnotist will intentionally raise his or her arm, but only the hidden observer is aware of it. Who is hidden observer here? The second stream of activity which is at the background, but which is not active to the suggestions given by hypnotist. And the mainstream, what is mainstream here? The mainstream is one which is following the instructions of hypnotist. So the mainstream of consciousness that responds to the command is blocked from this awareness that it is purposefully lifting. It just blindly does whatever suggestion given by hypnotist and perceives that the arm is raising all by itself, but not because the person is purposefully lifting. So they are not aware that they are doing it by themselves. They feel that it is automatically getting raised. So this is the dimension, I mean this is the reason why people say they act but they are not completely involved in it in the process of hypnotism. Now the second perspective or second category of theory I would like to share to explain hypnotism mechanism is social cognitive theory. So as the name indicate, here the social process as well as a person cognition, that is how they think, feel, is also influencing. So social cognitive theorists propose that hypnotic experience results from expectations of people who are motivated to take a role of being hypnotized. As I said you before, it's not a magic, it's not any fake drama, it is all depends on the person who makes up their mind, who is ready to take part in a process of hypnotism. If a person is skeptical, he is very doubtful about getting into hypnotism and his suggestibility levels are less, which means he didn't made up his mind to take part. But here, if a person is ready to follow whatever the instructions given by, then his suggestibility levels will be higher. So what's happening here is getting motivated, getting convinced yourself that you will follow the instructions, whatever the instructions given by the hypnotist. So most people believe that hypnosis involves a trance-like stage or a state and responsiveness to suggestions. So people motivate to conform to this role. So they make up their mind that I'll just follow whatever he says. He in the sense whatever the hypnotist says. Because of this readiness to respond to the hypnotist's suggestions and to perceive hypnotic experiences as real and involuntary. So because they make up their mind that I just follow the instructions given by, they just feel it is automatic and they are not actually involved, it just happening involuntarily to them. So now do not misunderstand that social cognitive theories or these theories imply that hypnotized people are faking, not at all. These theories emphasize that people immerse themselves into the hypnotic role, they observe, they take their role, they believe that they are doing right in that. So they just follow whatever he says, I do. They are not thinking it is right, it is wrong, or they are not doubtful about what they are saying. So the more convinced you are in the process, the more you are gonna get influenced by hypnotism. So their responses are completely real and may indeed represent altered experiences. Often we literally see what we expect to see. So if you believe in hypnotism, it works for you. If you don't believe or your suggestibility levels are less, the influence of hypnotism will also be less on you. For example, the hypnotized subject or a person whose arm automatically raise in response to the suggestion genuinely perceives that behavior to be involuntary because this is what the subject expects, and because attention is focused externally on the hypnotist and the hypnotic suggestion. He just removed his attention on other things. Blindly he starts doing whatever he says. So he believed that hypnotism can happen and that is working on him. So with which I just want to sum up the concept of hypnotism. So as I insisted, just remember hypnotism is a social interaction and the influence or the impact of hypnotism depends on the level of or the amount of suggestibility a person undergoes. But hypnotism can work provided a person is open up, and it would be fruitful if you integrate that with any other therapies rather than solely by hypnotism. But still, I want to conclude saying one thing, still hypnotism is a controversy. Some researchers rely on that. Some say solely hypnotism can work, but some says hypnotism to some extent can relax a person, but purely we can't say that it is highly therapeutic by nature. Whatsoever, it's a fact that hypnotism can influence and alter a state of consciousness of a person. Now, let's discuss about another altered state of consciousness, that is called meditation. So, how many of you do follow meditation? If not, please, I hope rather than just studying this as a theory, please take it as an opportunity and start motivating yourself to do meditation. Yes, I would say if you see the continuum of and consciousness, meditation is the highest level. Like in your day-to-day life, what you're aware around, you have lots of distractions in your consciousness. But when a person meditates, he attains a higher level of consciousness. So let me start defining. Meditation is the act of focusing on a single target such as the breath or a repeated sound to increase awareness of the moment. So they don't imagine the past, they don't sleep, they don't dream, they don't worry about the future, they just focus on the moment. While hypnosis is generally achieved through the interaction of a therapist and the person being treated, and whereas in meditation an individual can perform by himself. Often, however, people wishing to learn to meditate, it would be preferable, to receive some training in the techniques to achieve a healthy meditative state. Although there are a number of different techniques in use, the central feature of all meditations or any type of meditations is clearing the mind in order to achieve a state of relaxed awareness and focus. Yes, meditation have many positive effects on body, on both mind as well as body. I mean, if I start explaining the benefits of meditation, this one class would be not enough. So when compared to non-meditators, people who meditate seem to have lower blood pressure, lower levels of body stress hormones and enhanced immune system. Yes, meditation also seems to have powerful impact on brain activity. As I told you before, under the topic of characteristics of consciousness and altered state of consciousness, to measure various states of consciousness, altered state of consciousness, one way to measure is using an equipment called EEG. What does EEG mean? EEG means electroencephalogram. This is used, actually this have been equipped to a person when they are meditating to see how the brain waves or brain activity levels is. So when this have been done, the data showed a strong increase in alpha rhythms. This is one kind of brain waves associated with high state of relaxation. So if you practice in this day-to-day busy life, if you practice this meditation, it would be very helpful. Now there are lots of types and many types of meditation, but broad classification today I would just like to focus on two types. The first type is a path of concentration. In this kind of meditation, person directs attention away from the external world, focusing on specific object such as a small chant, mantra, or I would say short prayer, a picture or a candle flame. Now a second kind of meditation nowadays, it actually become very popular, and this kind of meditation is known as mindfulness meditation. In this type of meditation, the person focuses on observing the actions of a mind itself and his senses. Here when the person be mindful about what's all thoughts are going in his mind, what's happening around him. Like if a cold breeze is touching his tip of a nose, he has to sense it, being mindful, being aware of what's happening around. So this is a second kind of meditation. So apart from this, you have many other types like body guided meditation, where you focus on relaxing all parts of your body. Now, meditation also have significant role in religion, especially in Eastern religion like Hinduism and Buddhism. Using meditation, the individual progresses systematically through different levels of consciousness, each seen as superior to normal waking consciousness. And in Eastern perspective, the highest goal of meditation is to enter a state of consciousness in which the experience of self and world are subsumed within a more comprehensive perspective, and personal goals at this state and identity lose all importance. I mean, the meaning in life for people at higher state of meditation, what they achieve is much beyond. While in the West, meditation is often used to produce a relaxed state that allows a person to handle stress more effectively. Well, dear students, as I said to you before, I'll provide a link in the text, please, where it consists some of the instructions of how to do meditation. Please do use it and take this as an opportunity to start practicing meditation. Now students, it's time to conclude. So I would like to conclude saying that hypnosis is a focus on the self that involves suggested changes of behavior and experience, whereas meditation involves relaxed yet focused awareness. Hence, both hypnotic and meditative states may involve altered states of consciousness that have potential application for the treatment of various physiological and psychological disorders. So thank you. Hope this video will help you in understanding the importance of meditation and hypnotism.